What is the process for a patient who wants a 360 but is from out of town? The process is we schedule a consultation, we talk on the phone for about an hour, you schedule your surgery date, you come to LA a couple days before the surgery, you plan to stay in town for about a week. Do you do a 360 lipo under local or general? I perform all my procedures under general. How long after a 360 can you go back to work? I advise my patients to plan at least 2 weeks off of work, so just around 2 weeks you can go back to work. What is the lowest and safest BMI for 360 fat transfer BBL? The truth is that there is no lowest. I've operated on patients as low as 17, 18, and it just depends on where their fat distribution is, meaning do they have enough fat to do a transfer, and two, what are the goals? So if you have a patient who has a very low BMI and they're willing to accept kind of a very minimal or subtle improvement, then you can do the surgery. If you have a patient who has a very low BMI and they're expecting a huge volume increase, that's obviously a setup for an unsatisfied or dissatisfied patient. How long should I wait after a baby to get a 360 and breast dog? Typically, we recommend waiting at least 3 months. Can you do fat transfers to hip dip areas? Absolutely. We perform fat transfers to hip dip areas in just about every 360 BBL procedure. Can men do 360 liposuction and do a fat transfer to the hips? Yes. However, if you're adding a lot of fat to the hips on a male, it may feminize the physique. Can you transfer arm fat to your hips or buttock? The answer is yes, absolutely. You could transfer fat from any portion of the body into the buttock or hips. What can you do for cellulite? This is a great question, and cellulite has been a big problem for us for a long time. Until recently, we didn't have a good solution. I think we actually have some pretty good technology now. InMode, the company InMode, created a larger or longer needle that attaches to their Morpheus device. So I've had Morpheus for a couple years, but now there's a new handpiece for Morpheus, and that new handpiece has been shown to help. I'm one of the first providers in Los Angeles, Beverly Hills to have it. So stay tuned for that. It's going to be really exciting technology, and it's been proven to work. Do you prefer J Plasma or Morpheus for skin tightening? Great question, and I prefer both. So why do I prefer both? Well, because they both do different things. The J Plasma is going to go internal and tighten the skin internally, while the Morpheus is going to go external, and it's going to help a little bit more of that crepiness and fine lines. So it just depends on what the problem is, but in my opinion, combination therapy works best. Have you ever had anyone die from complications? I think this is kind of a morbid question, but we get it a lot, so I'm going to address it. The answer is no, I've never had a fatality. Additionally, any type of fatality is reportable to the state. So this type of information is available to the public through the medical board of the state. What are the entryways for a BBL, and do they show the scars after? Typically, you will have 2 incisions in the groin that are very covered up, 1 in the belly button. You'll have 2 in the back, in the buttock crease, and then 2 more in the dimples. Additionally, some patients require an incision in the back. Absolutely, you're going to see the scar. It's just a matter of how much. But anytime you perform surgery, there will be a scar associated with it. How long do you have to stay off your buttock after a BBL? I recommend patients staying off their buttock for about 1 week. I think 2 weeks is the max. Anything after that is excessive and not necessary. How soon can I have a round 2 BBL? I think that you can have it as soon as 3 months after your first surgery. However, most patients would probably wait 6 months to a year. How do you remove flabbiness from inner thighs or arms? It depends what you mean by flabbiness. Usually when patients say flabbiness, they're talking about both extra fat and a little loose skin. So for the fat, we can lipo. For the skin, we can tighten it with Renuvion and Morpheus. How long do the dents last after a BBL? It's an interesting question because it depends on what kind of dents you're talking about. Sometimes you see the dents during the live surgeries, and that goes away in about 15 minutes. But a lot of times patients have dents which are really cellulite, and if you have cellulite before the procedure, you're going to have cellulite after the procedure. Those won't go away. I weigh about 120 pounds. Is a BBL possible? It depends on how tall you are and how much fat you have. Short answer is yes, you can most likely do it, and this is of course without me knowing your height, but the results may be limited, so it's just a conversation to make sure that given your height, weight, that the results that are achievable are in line with your expectations. Will you lose the results if you lose weight after a BBL? I think this is a great question, and the answer really has to do with calorie intake. So if you have a surgery you're going to need to consume or eat at least your maintenance calories. If you have a surgery and then afterwards really decrease your calories or don't eat enough calories, yeah, you're going to lose weight. And part of the weight you lose is going to be in the result. Do you use drains after surgery? The answer is sometimes. If you're high BMI, or if we are performing Baser angioplasty, the answer is yes. If you're low BMI and we're not using technologies, the answer is probably not. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.